Good evening, everyone. I am delighted to welcome you all to the World GNM Day celebration. Myself, Dr. Dharmesh Varsani, practicing predictive homeopathy since last 20 years here in Rajkot, Gujarat. And lately, I am a ardent GNM follower. Today, I am here to discuss how GNM helps me to solve emergency kind or very critical cases. I would say so-called critical cases because it is stamped as a critical cases by the modern medicine. But how to understand such critical cases and curing it with the help of homeopathy? I came to know about GNM and its conflict from my guru, late Dr. Praful Vijayakar sir. Initially, sir uses conflict cure very incurable disease. Actually, Dr. Vijayakar sir is known to cure. He's a lion of homeopathy. He's called lion in homeopathy, and he was known for curing the incurable cases. And sir used the GNM and its conflict very much in his cases. It is Dr. Varghese sir who started the WhatsApp group of GNM and introduced us with the full website of the GNM, where I could see biological law. And after reading the biological law, it was kind of mesmerizing feel, you know, because in homeopathy, the basic of the homeopathic is the disease is dynamic. It is actually very hard to make someone understand how things are dynamic. Actually, when our colleagues or friends or any medical practitioner who used to ask us how your medicine works and what are the dynamics in the disease, so it was hard to explain them because ours is a spiritual science. There are no biological definition about it. It's completely depends upon the nature's law of cure. So this gap was always a kind of being very difficult to us to explain to a layman or any medical person. After reading the biological law, it become very much easy actually for me to make people understand how the disease is actually dynamic. Now I can show anyone with the brain scan can see this is the effect of how the disease is dynamic at the brain level. So then I started reading GNM very deeply, frequently, started using it in my day-to-day practice. Initially, I was testing it for 1 or 2 years. I was just testing it whether it is right or wrong. And I tried very hard to prove it wrong, but I couldn't. And it was the COVID time when this GNM, knowledge of the GNM greatly helped me. to gain confidence about not getting this infection or the scare of the COVID. So, my great tribute to our master, Dr. Hamer sir. Let us directly jump to the topic I want to share with you all. From the crisis to cure, managing critical cases with the lens of German new medicine. So, what is or why the disease become critical as per the GNM? What is the understanding of GNM in critical cases or emergency cases? And the answer is what I have understood from the GNM. The answer is the syndrome. Now, what is syndrome? Will not go in deep because I want to share my cases. It is everything is given in the website in detail. But syndrome is SBS of the kidney collecting tubules and any biological special program in healing phase. So here two things is involved. It is kidney collecting tubules in its conflict active phase, due to which there occurs water retention, and any ongoing biological special program, especially in healing phase. So when the organism withholds the water, the excess fluid is also stored in the healing organ and in the correlating brain relay. Hence, the size of the edema that develops in PCLA is not only determined by the magnitude of the DHS and the intensity of the preceding conflict active phase, but also by the degree of water retention due to an active abandonment or existence conflict. So here what happens, generally in any SBS, its healing phase is, or the edema is decided by the intensity of the DHS or intensity of the conflict active phase. But here it differs. Even if the DHS is not highly intensified or its healing phase is not that much retaining water, or in healing phase or edematous phase, but with the syndrome this completely changes. Now in the exudative phase, the edema of the ongoing SBS as well as the edema of the water retention due to the KCT or kidney collecting tubules will greatly enlarge this healing phase or swelling. And such syndrome we can easily get to know by blood urea and creatine level in blood, or by measuring the urine output. With the syndrome, the autonomic nervous system is in sympathetonia and vagotonia at the same time. Thus, extra sleep and the good appetite that are vital for the healing are disrupted by the conflict active state of the stress, with little appetite and difficulty sleeping. And the result, nervous exhaustion, weight loss, and energy loss. Now, this is the most important. Many a times in GNM, Dr. Hamer wrote such lines which has very high clinical values. The case I am going to discuss has lost 20 to 25 kilogram of weight in just 1 month. So it is very important to remember such lines or such symptoms. And the syndrome can create serious complications both on the organ and the brain level, especially during the epileptoid crisis. So it can create the serious complication, and any given case with syndrome can turn into a very complicated case. And it affects on organ level as well as the brain level. The list is very long. We'll go fast. A harmless swelling might turn into complicated case. A mild pain can become very unbearable pain. Cancer can become very fast growing or aggressive cancer with syndrome. Cyst can rupture. Effusion, for example, in pleural cavity, peritoneum, pericardium, can cause the serious complications. Skin condition, we'll see a case of very critical skin condition which become very dramatic. A simple skin condition become very dramatic with syndrome. Inflammation become more severe. Hepatitis become life threatening. So the most dramatic healing phase occur therefore with the syndrome, that is with concurrent water retention. So the dramatic healing phase can occur with the syndrome, and its effects on the brain level. A simple healing phase might turn into brain tumor. I will show you the case. How such extensive brain healing with the syndrome misdiagnosed with some other condition. Excessive brain edema even can cause coma and death. And in brainstem, such large edema can press on the respiratory center, which is life threatening. So read all this very carefully. You will find such thing in day-to-day practice, especially if you are dealing with the critical cases, emergency cases, grave pathological cases. Now the first case I would like to share is a case of mucormycosis. It's a 65-year male, old 65-year age old man with the history of uncontrolled DM, uncontrolled diabetes mellitus, history of CABG, his LVEF is 30%, hypertensive, chronic renal failure. In this condition, he caught COVID and he was living away from his family for a business purpose, where he caught this COVID and he went to hospital and got admitted. His both sons were out of Gujarat. One is at Poland, one is at Pune. Wife alone at home. Nobody there to look after him. And he got admitted in COVID hospital. After 20 to 25 days, his son came from Pune and they took discharge. He was a bit out of the dangerous situation, or he was on actually on oxygen for some times. So they took discharge and they bring patient to the Rajkot, to their hometown. Now on second day, patient developed such condition at home, and they went to physician primary consultation and asked for MRI, and found out to having mucormycosis of sinuses, orbit, and even extending to brain as per the MRI. Now the patient got admitted into civil hospital because back then mucormycosis was only treated at civil hospitals, and the only treatment choice was amphotericin, which is only available to government hospitals. But the problem was the patient having very low LVF. He had 30% left ventricular ejection fraction. Also, his create was high. He was having CRF since last 2 to 3 years. So the physician were in dilemma how to treat this patient, as the amphotericin is the only choice of treatment, and it is very toxic to kidneys. So they were not able to decide the treatment choice, and patient was admitted into the ICU. One of the sensible resident explained patient's son to get discharged because the mucormycosis has already been spread to the brain. Now there are no chances he could come back from this condition. He will get brain hemorrhage in 1 week, or he will pass away in 10 to 15 days max. So why to waste time here? Please have spend some family time with him at home. So son decided to get discharged, and they bring patient home. Some general practitioner from the neighborhood suggested them to try at least homeopathy, and they contacted a homeopath. They started treatment. Meanwhile, his another son from Poland came to India, and that second son was my old patient. I cured him of his psoriasis long back then. So he called me and told about his father's condition. He sent me reports, and I asked how he is. So son told he is a bit stable, at least not worsen after 10 days of homeopathic medicine. And the treating physician, homeopathic physician, was my very best friend and my colleague, and in fact a very good homeopath. So I told them to continue their treatment. So he was being treated with this condition, and after 1 month of treatment his condition got worsened. He started getting severe vertigo episodes, very dizziness. Actually, at that time, patient was not able to walk or move. He was in a very deep vagotonic state, getting very severe hypoglycemic attack. and they done retesting of the MRI to look at the brain and found out that all the lesion got increased. So now the son again called me and told me to treat his father, but I asked him, let me talk to my friend who is a homeopath. What's going on? I called that homeopath and asked what's happening, what is the progress. And to my surprise, he told me, see the MRI. Have you seen the MRI? He told me. I said yes. See, we can't do anything in this case. His mucormycosis is already spread to the brain, and now we can only palliate this patient. We can't cure him. As the mucormycosis, we can't. It's not possible to treat mucormycosis, such extensive mucormycosis. So immediately I called patient's son and told him, you come to me, I will treat your father. Now see, homeopath with the knowledge of GNM, what I want to convey a message to especially homeopath. Here a previous homeopath accepted its limitation due to finding at the MRI in which it is written that it is space occupying lesion and it is the extension of the very lesion which is found out at sinusitis. So this is how actually the radiologists are trying to see as per their knowledge. But when I look at this picture first time, actually I was happy seeing this. This is the difference. Without knowledge of the GNM, no one would say that patient's brain is healing. No doubt he has some other issues which we'll discuss. But we are dealing with the healing phase actually, and see the whiteness. It is telling that already the PCLB has been started. So after getting detail, very limited detail was available as the patient was in very disoriented state. Son gave me his history, a very short history. So my idea here is to treat this syndrome. See the extent of the edema in the brain. There are two portion of the brain is affected here. One is basifrontal region in the left side. It is the lowermost part of the frontal cortex, and right frontal lobe. So I could easily conclude that this both edema is the healing phase. One is from the sinuses. Paranasal sinuses is there in the basofrontal cortex, which we can see here. And due to syndrome, the healing become very extensive. It extend to whole length of the cortex. And on the opposite side, it was the frontal fear, which is resolving. So now in such cases, what should we do? Right? My prime idea is to relieve the syndrome. Otherwise, the organs are already in healing phase. So, my idea of treatment is to relieve syndrome and to help the already healing organs to facilitate its healing and to take care of the conflict relapses. So here I had symptoms of syndrome in the form of disorientation. See, with modern medicine, if such patient become disoriented, the modern medicine will connect it with the lesion or the initial brain inflammation. But if you know about the constellation and its symptoms, we can easily get to know that this is not about the healing brain. These symptoms belongs to constellation, and the typicalness of, in this case, the patient was experiencing very disoriented state, where his son told me that father used to go back to old neighborhood. He's talking about old neighborhood places, his old house. It's like 20 to 30 years older events. So this, if you read the KCT constellation, you will find all these words written there. Patient was already in CRF. Probably the one kidney was involved with the abandonment or existence conflict he experienced in his pastime. And the second existence conflict he must have suffered after he got admitted to COVID hospital. And this both conflict now created the KCT constellation. So if I want to remove the syndrome and its effects, I must remove these symptoms of the KCT constellation, which is disorientation, which is confusion, as per our law of the homeopathy, like cures likes. So that I'm not going deep into discussing that homeopathic part, but I took the symptoms of that KCT constellation and together with other characteristics of the patient, we come to conclusion for a remedy, and I prescribe him remedy. Then patient gradually started improving. In 3 to 4 days, actually, he completely came out of the disorientation and confusion. His hypoglycemic attack become less severe. At one point, his hemoglobin was 5, and my only ask to the family is I will not allow any single modern medicine, whatever be the condition, because when you are dealing with such healing phase, aggressive healing phase syndrome, a medication greatly disturbs such healing phases. Dr. Hamer has beautifully explained medicine regimes and its effects on the syndrome. Everyone must read it. It's very helpful, because in such cases, a simple antispasmodic even makes this patient go into hanging leg. So after 1 month of treatment, we do rescan. And after 1 month, the lesion greatly diminishes. This were the picture. The first picture was after the discharge from the COVID hospital. Second picture after 10 days of improvement. And third picture is of 20 to 25 days improvement. In 2 months, this patient actually increased 20 kg of weight. He got his original weight. And here is the short testimony. It is in Gujarati, in which patient give testimony that he haven't got a single allopathic or any other mode of treatment without then homeopathy.
કયો દામજીભાઈ કેમ છે હવે?
એકદમ સરસ.
આપણે કોવિડ થયો બેસનો
હા,
કોવિડ થયો એપ્રિલ
એપ્રિલ.
બરોબર.
હા.
અને મ્યુકર મેમાં
હા. મ્યુકર
એપ્રિલ એન્ડ અને મે ટૂંકમાં આપણે એમઆરઆઈ જે થયો હતો એ મેના ફર્સ્ટ વીકમાં અને એ ખરાબ હાલત સાથે મ્યુકર બરોબર બ્રેઇનમાં આંખમાં સાઇનસમાં આટલી જગ્યાએ મ્યુકર હતું. અત્યારની કન્ડિશન પ્રમાણે તમને તકલીફમાં અત્યારે હવે તમને કોઈ આટલો
I am asking now, do you have any problem?
તકલીફ નહીં સર.
He is telling, I don't have any problem right now.
વજન રેગ્યુલર થયું,
My weight got
રેગ્યુલર થયું.
regular.
હું ચાલી શકું છું.
યસ
બધું ખરું.
I can walk, I can run.
શરીર સારું
વજન વધી ગયું. વજન આ રીતે 9 કિલો હતું છેલ્લા 20 વર્ષથી. એમ જ છે.
આપણે 60-65 કિલોગ્રામ જેટલું
નીચું ગયું હતું.
થઈ ગયું.
લગભગ 20-25 કિલો નીચું ગયું હતું.
So, with the knowledge of GNM and predictive homeopathy, it is only possible, I think. If I don't know the GNM actually, then it would be very hard for me to show the confidence, not allowing any medication and deciding the treatment part, what to relieve first, give priority in treatment. Let's jump to the second case of Epidermolysis bullosa. It's a very grave disease. In my entire career, I have also seen first time such case. It's a very horrific case to witness. Epidermolysis bullosa is a group of rare genetic disorder characterized by extremely fragile skin that blisters and tears easily even with the minor trauma. It is a newly baby born after a normal delivery procedure, a baby born, and when a nurse attempted to clean the baby, the whole skin from the abdomen came out with such condition, and baby was crying horrifically. They were referred to Rajkot in my city to higher center. They got admitted in NICU. Parents admitted this baby to NICU, and the treating pediatric and dermatologist explained this parents that this is the condition epidermolysis bullosa, which doesn't have any definite treatment right now. We have to do for genetic profile, and that genetic profile report comes after 15 to 20 days. Till then, we'll try to help baby, admitting him into ICU, but we are not sure about the prognosis or helping him much. And due to some relatives' advice, these parents called me, sent me photographs, and asked my advice in this case. And my advice was, okay, if you bring this baby to home somewhere in here in my city at your relatives or any given place, I will treat him. Don't admit him if you want to save him, because what I have read from the internet, that epidermolysis bullosa having very high mortality rate, and it was very severe kind of or aggressive type of EB. So parents got convinced. I took detailed history of the parent first, but here we are dealing with a very dramatic. We have read this line in syndrome where Dr. Hamer has wrote, a simple skin eruption turns into dramatic one. So I could conclude that this is the separation conflict with abandonment. Otherwise, worsening never go to this extent with only separation conflict. Now, in such cases, we usually take the mother state, try to understand what separation conflict a baby might have registered during intrauterine life, but we couldn't find a single evidence of any distress in mother. And such dramatic or such critical situation happens only if the event is too much dramatic. But here we couldn't find a single dramatic event during 9 months of pregnancy. So, in separation conflict, Dr. Hamer has wrote how intrauterine life or intrauterine baby get the separation conflict due to the ultrasound. So I asked mother about ultrasound, and there was some information, typical information about ultrasound. Actually, he was at Pune. She was at Pune during her early pregnancy months, where only one time USG was done in 7 or 8 months. Then after he went to his village for further delivery process at his parents, where they consulted a gynecologist, and last month there were 3 to 4 USG were done. In homeopathy, we try to understand the mother state. We call it soil for a baby. And in this case, the mother state, what we got is highly fearful, highly abundant, or a forsaken one. So, in short, my analysis was a very fearful, very forsaken mother provided a forsaken soil to this baby, and with such fear of forsaken in baby, got very disturbed by the ultrasound, the noise of the ultrasound, and with this understanding effect of this ultrasound, noise sensitivity, 4-second feeling or fear of 4-second in baby with syphilitic skin condition. I prescribe this baby a remedy, homeopathic remedy, which is borax. After 24 hours, the baby become very calm. Actually, it was hard to see that baby. He was crying so horrifically. It was very hard to relieve him. Simple, even when mother touches him for feeding, he cries a lot. But after 24 hours, homeopathic medicine greatly relieves the syndrome. And the beauty is, when you relieve the syndrome with medicine, the result is highly dramatic in 24 hours. And after 4 days of treatment, skin become less, eruption become less dramatic, baby become very calm. 7 days, and after 1 month of treatment, most of dramatic skin condition went away. Now only the remaining part, milder separation conflict coming and going, which can be dealt easily afterward, because it will take a long time to treat such cases completely. But the baby came out of danger, and without a single allopathic medication. What I learned in this case, that when parents ask doctor to take discharge, then doctor asks them, okay, this how this baby will survive in outside. He got no skin, he will get infected. And parents ask me this question, how we will manage such sanitations? What about the sanitations? Will catch the infection. At that time, due to the knowledge of GNM, I explain patient he won't get any infection provided we don't attack him. If you admit him in ICU, he will get injected, he will feel more abundant, cavity will worsen together with other organ involvement. So trust me, we'll make it happen. And in normal environment, this baby didn't catch a single germ in spite of having very raw skin, very exposed skin. So again, this is the beauty of the GNM and predictive homeopathy. To confidently saying patient to get discharged and treat them at comfort at home with marvelous results. Third case, recently I got this case before 3 months, case of Sino-orbital Mucormycosis. Let's see the video. It's a completely dead eye, completely loss of vision, ptosis, proptosis. This patient went to or admitted to hospital before they came to me before 1 month. And after 1 month of treatment, he got operation of sinus debridement, which is called, and 1 month of amphotericin treatment couldn't relieve much, and the treating physician already told patient to remove the eyeball, as the now almost this infection has spread to the base of the brain. And after 1 month of treatment, they done MRI, which shows increase in size and extent of the lesion even after 1 month of treatment, and it's reaching to the base of the brain. Now this patient called me when I was actually closing my OPD at night, and patient told me, doctor, we are going to remove this eyeball tomorrow, can you help us? See, with the knowledge of GNM, because patient told me, because doctor told us that this mucor has already been at the base of the brain, now it will spread to the brain, so can you save it? I told them, yes, I can, but I will take case first, then I will tell. Sometimes after taking the case of the patient, we come to know his conflicted mind, and here we supposed to treat with homeopathic medicine alone, sometimes which may work, which may not work in real time. The problem is to work in real time. If our medicine doesn't work for 10 to 20 days in such cases, and if we believe that infection can spread to brain, then we never took such cases. Why should we burn our hand taking such cases, especially the beginner homeopaths or middle age homeopath? But due to the knowledge of this GNM, I told patient, give me 5 days. If in 5 days you find improvement, you continue my treatment. Otherwise, you can opt for the surgery. So here you can typically see the syndrome, very extensive inflammation, extensive swelling, all the eyeball muscle paralyzed, lid paralyzed. Patient having very severe periosteal headache, numbness, not feeling anything around the eyes, not even injection or needling. So I started treatment, and after 24 hours, she improved this much. After 48 hours, now patient actually, in such cases, patient usually having aggravated existence conflict or syndrome due to ongoing very serious case or incurable disease condition. So once the patient shows such improvement, our work is half done, because this condition is purely in healing phase. If we check the conflict relapsing, we can wait and watch for recovery. Nothing to do much. This eyeball, her eyeball came to life. Still there is a ptosis is still there, but eyeball must in before 5 days video. How the proptosis is gone. Patient is completely healing phase. We are waiting for his eyesight still. So in these all three cases, knowledge of syndrome, confidence of biological laws, and knowledge of predictive homeopathy and my sir's teaching, Dr. Vijayakar sir, I can do this wonder and bring this dead organ to life again. So this is the power of GNM with homeopathy. I conclude this webinar with a very great line which actually changed my life, which Hamer wrote in biological law, second law actually. We have to resolve our conflict twice, first in real terms, then spiritually. This one liner actually makes a very deep sense, and it is the line which completely changed my life too, because I started believing in Dr. Hamer much in his every words, and when he used spirituality, so I started following spirituality from my Hindu religion. I started reading books, and where I find a beautiful correlation in Srimad Bhagavatam. It has been written, due to this external energy, here the God is talking about the conflict. Due to this external energy, the living entity, although transcendental to the three modes of material nature, think of himself as a material product and thus undergoes the reaction of the material misery. Here, God explained actually GNM. Let me explain it. Due to this external energy, means any external event, the living entity, a human being, although transcendental to three modes of material nature, transcendental is called gunatit. Three modes of material nature is given in Bhagavad Gita as a sattva, rajas, tamas. So soul in purest form, living entity in its purest form, is usually transcendental, is not bound to this material nature of these gunas. Actually, the vital force or living entity is transcendental. God has gifted us this. But the human being think of himself as a material product and thus undergoes the reaction of the material miseries. But we think ourselves as a material product with our name, with our ego, with our attachment, with our desires. We become material, and thus we undergo the reaction of material miseries. Now just change here one word, remove the material and apply the biological, and it will be completely first biological law. Due to this external allergy, the living entity, although transcendental to three modes of the material nature, think of himself as a biological product and thus undergoes the reaction of biological miseries. What Hamer explains us in first biological law, we become once we become conflicted with our feelings, with our emotion or our symbolic thoughts, we start to tell our brain that my liver is small, my heart is weak, my muscle is weak, and that's why it gives us more heart, more liver, more material. So see how these two things are aligned, and this completely blown away my mind. I'm using now GNM not only for practicing or applying it to homeopathy, but it greatly helps us for a personal growth as well as the spiritual growth. We can understand with the GNM, we can understand life right through the material or cellular to the spiritual level. So it's my genuine advice to all fellow homeopaths, irrespective of the school of homeopathic method they are following. Just take this dynamic science, apply it, apply GNM, explain GNM to patient, family, friends, spread it to the world, and have personal and spiritual growth with it. Thank you.